What I tell patients at home are to grab, several Kleenex or a couple paper towels and then try to blow out their nostrils, kind of blow out all the clot that sometimes collects in the nose cavity. There's actually a lot of room in there. And so try to blow it out because sometimes what happens is wherever it's bleeding from, the clot can form over the area that's bleeding, but not adhere to the surface. And therefore, it kind of oozes underneath a clot and you can't get pressure on it. And so, in my opinion, the first thing to do is blow it out, which of course freaks people out because if they have this big blood clot come out, they're like, I'm bleeding to death. But the good news, they're not. And then, so blow out the nostrils and then hold pressure just below the nasal bone, so the hard part of the nose, and clip both sides with your, like a thumb on one side and a finger on the other side, and hold that for 10 minutes. Obviously, that's kind of a lot of potential pressure, so sometimes you have to switch hands or do whatever. But try to then, I ask also people to watch a clock because unfortunately, 10 minutes is a really long time if you're waiting for it. And so unless you time that out, there's no way to like count 10 minutes because I think you'll sort of lose time. What I recommend too is to repeat the process. So if after that 10 minutes it's still bleeding, repeat everything all over again. So paper towels or several Kleenex, blow out the nostril, and then put pressure, and then hopefully that'll be enough to make that so it'll stop bleeding. And I asked them to do it 3 times because I think sometimes it takes that amount. And I think if we get past that point, then it may be time to come see us in the emergency to let us help look at it and decide what to do. There are also the kind of common beliefs about like ice on the bridge of the nose. I don't think that unfortunately does anything. I don't think you should stick anything in there. I've had patients before show up with like unfortunately a tampon in their nostril. And the unfortunate part about that is they expand. And so it's really hard to manage to pull that out. So unfortunately, you don't realize how much they could expand. And so I wouldn't recommend that. So I wouldn't stuff it in the nose. I wouldn't do that.